Hi, I'm Dr. Lexi Lane with Summit Vitality, and I get the question of what is naturopathic medicine? And hopefully this little short video will help you to understand that better. So we are actually trained as primary care physicians, and ideally we have a non-pharmaceutical approach, but as part of our training we have a philosophy that's based on 6 principles. The first principle is first do no harm. And this is something that you're going to find across the board in any medical community. We definitely don't want to harm the patient. But how we do that is, first of all, we like to respect the healing laws of nature. Respecting what is naturally occurring in the body and restore and nurture those processes. And if some things are going wrong, we like to find and treat the cause. We find and treat the cause by using what we call specialized tests. These tests aren't always done with your primary cares that you might know them, so we're going to be digging a lot deeper into understanding the biochemistry, maybe understanding the microflora in a more in-depth point of view to really help us to, yes, find and treat the cause. Another thing that you're going to realize is that our time with our patients are actually a lot longer. You're not going to be having that quick 15 minutes. Usually a visit's going to be about an hour long. Your first visit with an ND is going to be about 90 minutes to 2 hours, depending on the provider. They're that long because we really want to understand what's going on with you and your body. And in order to do that, we have to get your story and we have to go through a full review of systems head to toe. I like to tell my patients, I'm going to be asking you questions that may seem related or unrelated to your chief complaint, but it's all important. All moving parts in your body are equally important. Then we like to educate our patients. Education is so important because we want you to understand why it's important to have a whole food diet. We want to understand if we're going to give you a supplementation program, what is it that you're taking and what for? If things are going wrong, we need to have a collaborative relationship. And so education is going to be really key. We also like to treat the person as a whole. Going back to my original comment of sometimes I'm going to be asking questions that may seem unrelated to your chief complaint. Well, one of those things is going to be the mental emotional realm. Well, I came in with gut problems. Why are we talking about my feelings? Well, a lot of times when we are feeling afraid, we actually might have gut symptoms get aggravated. Fear can increase our blood pressure. It can increase our heart rate. It's where anxieties come into play. So there definitely is a connection between that mental, emotional, and physical realm, and all those things have to be considered. And then finally, prevention. Prevention is so important. Let's prevent you from getting that chronic disease like cardiovascular disease or diabetes. Let's work on things a lot earlier. That way, this can be a really beneficial and fruitful field of medicine, but that doesn't mean that if you have a chronic disease, we're not a good fit. We are absolutely a good fit. It's a collaboration and an integration that's so important. So don't see us as an all or nothing. Definitely see us as a tool. But NDs are fabulous, and if you have more questions, you can always go to my website at www.summitvitality.com and definitely check out the discovery session video, because if you're still wondering and you still have questions, that might be a really good fit for you. I'm Dr. Lexi Lane with Summit Vitality. Thank you.